Okay, we'll look at chapter 7, the endocrine system, which is made up of ductless glands that secrete hormones into the bloodstream. The endocrine system collection of glands secrete numerous hormones at distant sites in the body. There's a wide range of functions. They stimulate growth and metabolism. Others help with tissue and sexual function. Some regulate reproduction, sleep, and mood. So we're going to look at some of these. So here it shows you the network of ductless glands and other structures. And this picture kind of shows you some of them starting from the brain, where we have the hypothalamus pituitary gland, the pineal gland. In the throat area, we have the thyroid, parathyroid, adrenals, which are on top of the kidneys, the pancreas, ovaries, and testes. We look at the adrenal glands. Again, they sit on top of the kidneys, located next to each kidney. We have the adrenal cortex. It secretes steroid hormones, which regulate carbohydrate metabolism and salt and water balance. And the adrenal medulla, which secretes epinephrine and norepinephrine. So remember, that's kind of like your fight or flight that we see within the body. It is also responsible for steroid hormones, which regulate carbohydrate metabolism and salt and water balance. So that would be like glucocorticoids, mineral corticoids, and androgens. This is another picture in your book that kind of shows you the different areas that we just kind of saw. The ovaries, which are going to be responsible for the hormone estrogen and progesterone, responsible for the development of female secondary sex characteristics and the regulation of reproduction. They're located one on each side of the uterus. Estrogen helps with female secondary sex characteristics and regulation of reproduction, where progesterone regulates uterine conditions during pregnancy. When we look at the pancreas and the isolates of Langerhans, it's located behind the stomach. It's kind of like the center or the core of your body. It functions to secrete insulin and glucagon. And it also regulates carbohydrate and sugar metabolism. And we look at the parathyroid glands. They're located on the posterior aspect of the thyroid gland in the neck. And its function is to secrete the parathyroid hormone, so PTH, and regulates calcium and phosphorus metabolism. The pineal gland is located in the center of the brain. It secretes melatonin and serotonin, and it's involved with the circadian rhythm, constricts blood vessels, and acts as a neurotransmitter. The posterior gland, which has an anterior and a posterior. The anterior pituitary gland, adenohypophysis, and the neurohypophysis. So adenohypophysis is located at the base of the brain. Secretes thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone, melanocyte stimulating hormone, growth hormone, and prolactin. The posterior pituitary, the neurohypophysis, releases what we call ADH, or antidiuretic hormone, and oxytocin. So the anterior is going to stimulate secretion from thyroid gland, adrenal cortex, initiate growth of ovarian follicles, stimulate secretion of estrogen, causes ovulation, affects skin pigmentation, influences growth, stimulates breast development and milk secretion. And then the posterior influences the absorption of water by the kidney tubules and influences uterine contraction. Testes are located on each side within the scrotum in the male and functions to secrete testosterone, and it affects masculinization and reproduction. The thymus gland, located in the mediastinal cavity, anterior to and above the heart, functions to secrete thymosin and regulates immune response. Thyroid gland, located in the front of the neck, secretes triiodothyronin, thyroxine, and calcitonin, and regulates metabolism, calcium, and phosphorus. It's just kind of breaking down here, the actual gland, and then the secretion, the hormone it secretes, and then the function. And then this one kind of shows you higher up within the brain, and then the neck, hypothalamus within the brain, pineal gland, pituitary gland, and then down to the thyroid and parathyroid. And then the alimentary canal, or the area that said to function for digestion. Sometimes you will see that the pancreas is included in the what we call the GI system or digestive system, because it is needed to digest. So we have to have it. So here you see the liver, the stomach, and then you can see the pancreas is behind that. So it's why it's very hard to diagnose when somebody has a pancreatic problem, because it's kind of in the core. So it's kind of misdiagnosed sometimes for abdominal issues or pain. The duodenum is going to be the start of your intestines. You see the kidneys on each side with the adrenal glands on top, and the adrenal medulla in there as well. When we're looking at issues with over-functioning or under-functioning of some of the hormones, here we have somebody that has hyperthyroidism and hypothyroidism. So over-functioning and under-functioning. So you could see that the signs and symptoms could be a little bit different. So if you have a patient that has over-functioning, then you would have thin, silky hair, hair loss, perspiration. Their eyes bulge out, so the exophthalmia or exophthalmos eyes. So again, the thyroid is overproducing. They could get what's called a goiter. Their neck is very thick and kind of looks like almost like an inner tube around there. Their heart races, they lose weight, they stop having their menses, the skin is warm and moist. They might have an increased appetite but don't gain weight. They could be restless, nervous, have tremors. The tendon reflexes are brisk. Versus decreased functioning thyroid, the hair is dry, brittle, hair loss. They have swollen face and eyelids. So often we get this like with steroid use, their face is very big. Thick, heavy tongue with slow speech, and the voice is coarse. Skin is pale, cold, and dry, a little bit more lethargic, maybe depressed. They bleed more on their menses, less perspiration, heart rate goes down, and they gain weight. Some of the combining forms we see obviously are going to be related to the gland. So adeno just actually means gland. So adenoma would be tumor of the gland, where you put an R in it, adreno or adrenal would be referring to the adrenal gland. So adrenotrophic or adrenalopathy. So we have the L and not L. So we would be looking at the disease of or study of the adrenal gland. Andro or male, so androgynous is referring to the male. Sometimes you'll see that pronounced a little bit different depending on the suffix. Crino or crino is to secrete, so endocrine is to secrete or secreting hormones. Dipso is thirst, polydipsia, poly is many, so excessive thirst. Glucose, glyco all means sugar. So which glucose is sugar, so glucogenic pertaining to the sugar, glucose, and hyperglycemia is excess of sugar within the blood. So hyper is a lot, glyc is the sugar, and emia is blood. Hormonal, referring to hormone, or urging on, hormonal, pertaining to, so let's say somebody's hormonal. Keto, ketona, ketone bodies, so ketogenic. It's referring to pertaining to the ketones, and ketonuria. Urea is referring to in the urine. So they have ketones in their urine, which we see with diabetes. Pancreatic, pancreatitis, inflammation of the pancreas. Thymo is referring to the thymus gland, thymoma, tumor of the thymus gland. thyroid-O, referring to the thyroid gland, which resembles a shield. So thyrotoxic is like a toxic refers to a poisoning or something that's killing. Thyroidotomy would be incision into the thyroid gland. This here's a picture of a person that has what we refer to as Cushing syndrome. So when we look at some of the pictures, the patient will take on the characteristics of a kind of like an upper body obesity and facial puffiness. We see that moon-shaped appearance, and they often will have a hunchback. It comes about with an excessive level of cortisol hormone. It may be due to excessive production by the adrenal gland. Could often be a tumor, could be a side effect of treatment with steroids. So a lot of people get prednisone for inflammatory issues like asthma, arthritis, lupus, and they have that classic, what we call a moon face, and then they typically have what we call a hunchback. Blood sugar is usually high, they're weak, thin, and easily bruised, stretch marks, hypertension, acromegaly. We see this person, it's kind of hard to see, I think, in this picture here, but it would be a disease characterized by enlarged features, the face and hands, hypersecretion of the pituitary growth hormone, usually after puberty, when normal bone growth has stopped, most often caused by a pituitary tumor. So this, again, it's hard to see, but he has a very large face and his hands are very large. And then we have dwarfism, which would be the opposite of the big person. It would be little people. And then oftentimes we have different characteristics of that. So dwarf would mean to be smaller or less than. And then some people that have dwarfism, it's characterized by different body structure. So if you look at this one picture going from the little person on the end, almost that would resemble a child, and then as you go up you can see the different three in the middle, dwarfism, where some of them are proportionate to their body and some are not. So we do see a difference there. Hyperthyroidism, we talked over the stimulation of the thyroid gland. It results in exophthalmia or exophthalmic eyes. So you can see here where that person's eyes are bulging out, and they're not doing that by opening their eyes more. This is often referred to as Graves' disease, not so much anymore, but some people still call it that. And then they have an enlargement of the thyroid tissue caused by the thyroid dysfunction, and they form a goiter. So we used to see this a lot due to lack of iodine in the diet. But in the US, we added iodine to salt. We use salt a lot, and that kind of took care of the causes of goiter from that. But if it's an overactive thyroid, then that person would have to be treated for that. This is a thyroid uptake image, so we can actually give medication, and then that thyroid will take it up. So we give a form of nuclear medication or radiation, and then that thyroid takes it up, and then it can destroy tumors that are in the thyroid. An insulin pump is where somebody has diabetes, so where we have the pancreas doesn't secrete the insulin that's needed, so the body has to have synthetic insulin or injections of insulin. So we have the ability to use this pump. It's an insulin delivery device that's worn on the body, and then there's a little needle into the skin, subcutaneous, that's going to release the insulin into the body based off of the needs of that person, or the when we check the blood sugar, the numbers of that blood sugar. So some of the symptomatic terms that we see, so exophthalmos, we talked about that, meaning the bulging of the eyes. So when somebody's eyes are protruding. Glucosuria is the presence of glucose or sugar in the urine, or sometimes glycosuria. Hirsutism. Hirsutism is a shaggy or an excessive growth of hair, especially unusual places, like for a woman to have a beard. So the picture here that she obviously has hirsutism. Hypercalcemia is an overproduction or increased level of calcium in the blood, so the anemia. and same with hyperglycemia, so hyper excessive glyc sugar anemia in the blood, hyperkalemia, hyperpotassium in the blood, so hypotassium. Hypersecretion would just be an abnormally increased secretion of something. Ketosis, ketoacidosis, or what we call DKA, is the presence of abnormal amount of ketone bodies in the blood and urine, indicating an abnormal metabolism of carbohydrates, carbos such as an uncontrolled diabetes and starvation. So keto altered, and then DKA is diabetic ketoacidosis. So a person that's diabetic, their blood sugar goes way too high. They have too many ketones present in the body. Metabolism is just the chemical processes in the body that result in growth, generate energy, eliminate waste, and other body functions. So your body has to metabolize to function. Polydipsia, again, poly meaning many, and dips is a thirst, and ia is condition. So condition of increased thirst. Polyuria is many in urine, so excessive urination. Diagnostic terms, so some of these we already saw pictures of. Cushing syndrome, again, signs and symptoms of excessive level of cortisol hormone. Adrenal virilism is excessive output of the adrenal secretion of androgens, the male sex hormone, in adult women caused by a tumor or hyperplasia, which means tissue enlargement, by like amenorrhea, so no menstruation, acne, hirsutism, which is the hair, and a deep voice, which is variolous. Diabetes mellitus, metabolic disorder by the absence or insufficient production of insulin secreted by the pancreas. Pancreatitis is inflammation. And back to diabetes, you can have type 1, which is you produce no insulin, which we see that usually early onset as a child or early adult, and then type 2, which is usually lack of insulin or the body's inability, and usually due to overweight, lack of exercise, and not eating correctly. Hyperinsulinism is a condition resulting in excessive amount of insulin in the blood that draws glucose out of the bloodstream, and then that person would end up having low blood sugar, fainting, convulsions. So we can see that with diabetics as well. Pancreatitis, inflammation of the pancreas, hyperparathyroidism, and hypoparathyroidism. So one is over secretion or hypersensitivity or hypersecretion, and the other is less, hypo. Acromegalia is enlarged features, especially the hands and face, usually by hypersecretion of the pituitary growth hormone after puberty. And then gigantism is also seen as well. And then pituitary dwarfism and pituitary gigantism. So lack of function of the pituitary gland could cause somebody to be too small and then too big. Goiter, we talked about that already, where you have the inflammation in the neck due to lack of iodine around the thyroid. Hyperparathyroidism, the Graves' disease, remember the exophthalmic protruding eyes versus hypothyroidism, slow, lethargic, cold skin, weight gain, slow speech. Myxedema is an advanced hypothyroidism in adults, and they're very sluggish, slow pulse, puffiness in the hands and face, and dry skin. It's kind of a result of hypothyroidism. And cretinism, this is where, again, a person can be result in stunted growth. Some lab tests that we see, obviously blood sugar is something that we're going to see a lot of. It could be blood glucose, blood sugar, it could be glucose test. We use different terms. Fasting blood sugar means we're going to check the blood sugar when they're fasting, so no eating or drinking. Postprandial blood sugar means that we actually check the blood sugar after somebody eats, where typically we check it before. Glucose tolerance test, we're going to give somebody glucose and see how their body metabolizes it. So we're going to give a certain amount going to check their blood sugar before and then every after, and usually up to 6 hours. Glycosylated hemoglobin A1C or hemoglobin A1C is going to give us a measurement of the level of blood glucose over a certain amount of time. So over a 3-month period of what the level of the blood glucose has been. That gives us an idea. And, over 6 is going to be high. Thyroid function test is measurement of the thyroid hormone levels in the blood. So often we see that as T3, T4, and a TSH. Urine sugar and ketones. So we're going to do a urinalysis to look at how many glucose and ketones are in there. Some diagnostic tests, CT scans, computed tomography, give us the imaging of enlarged or decreased glands. Same with MRI, magnetic resonance imaging. Sonography would be the ultrasound, which are least invasive, and thyroid uptake and image. So we're going to inject some nuclear medicine, or they don't have to inject it. They could also ingest it. So we can give pills for that person, and then it would do the same thing. That would take it up. Some operative terms: adrenalectomy is removal of one or both adrenal glands, and then hypophysectomy is removal of the pituitary gland. Pancreatectomy is removal of the pancreas. Parathyroidectomy is removal of the parathyroid. Thymectomy is removal of the thymus. And then thyroidectomy is removal of the thyroid. So what do those all have in common? Ectomy is removal of, and then of which gland is being removed. Some therapeutic terms, kind of what are these? Some of these, so insulin pump is going to deliver insulin via a subcutaneous needle into the skin. Radioiodine therapy is use of radioactive iodine to treat disease. So we use that for like the thyroid tumors, so that thyroid will take it up and then destroy that. Medications, anti-diabetic drug, it's going to control the blood sugar in diabetic patients. Antithyroid is going to block the overproduction of the thyroid hormones, like with hyperthyroidism. HRT is hormone replacement therapy. So when somebody goes through menopause, do we replace the estrogen, testosterone, thyroid measurements? If somebody doesn't produce enough testosterone, we can give them testosterone. And anti-hyperglycemic and hypoglycemic are drugs that are going to either lower the blood sugar, so hypoglycemic agents. So the anti-hypers were against the blood sugar going high, we're going to bring it down. And hypoglycemic would be agents that are also going to bring that blood sugar up to maintain a normal blood sugar. Some abbreviations that you might see. So ACTH, adrenocorticotropic hormone. ADH is antidiuretic hormone. BS is blood sugar here. DKA is diabetic ketoacidosis. DM is diabetes mellitus. Fasting blood sugar and follicle stimulating hormone, growth hormone. GTT here is glucose tolerance test, where if it's a small t, it means drop, GTT. Hemoglobin A1C is the HbA1c, the glycosylated hemoglobin. It's going to let us know over time what the blood sugar is. And then HRT is hormone replacement therapy. LH is luteinizing hormone. MSH is a melanocyte stimulating hormone. PPVS is postprandial blood sugar. PTH is parathyroid hormone. And T3 is the triiodothyronin, just T3, when we look at a blood test, and then the T4 in the blood test is the thyroxine level, and the TSH is a thyroid stimulating hormone. And that's it for chapter 7.